All right, it worked.
Yay, it worked. Yes, let me just
Yes,
see it.
all right,
My
fantastic. I couldn't get it to work the first time, and I had to log out and redo my internet, and so
it can be very stressful. Yes. Now we are live. Yay. Oh,
yes.
Great. Well, I'm so glad we connected, and thank you for taking time out of your busy day. I know.
Absolutely. I'm really looking forward to this.
Yes, I love it. Since, I don't know, I found you maybe 2 or 3 weeks ago, and I've really enjoyed your posts. I love seeing some of the procedures and the background, and it's very informative. And I also like the personal aspect of things too.
Thank you. I appreciate it. Thank you so much. No, I want my Instagram platform to be informative, and I want people to be able to, talk to physicians who are doing work in my field and be able to connect with me without having to go to the doctor's office to ask questions that maybe they're too either embarrassed to ask or don't have the opportunity to ask or haven't thought of before. Yeah. And it's really to bring a lot of awareness, because sometimes, IBS issues get either dismissed or they're considered something else, or they're diagnosed under another diagnosis. So this is kind of, a good way for me to bring about awareness that this is a real thing and what the science behind it is. And, kind of let patients also kind of learn about it, because I think when you bring awareness to these kinds of things, people realize that this isn't just, in their minds or in their heads. This is a real thing.
Yeah. And there might be some things that they can do to help, right? So
yes, very, very, very much so.
Before we jump into the IBS info, tell us a little bit about yourself, give us some background, and then also I'd love to know where you practice, so that if people want to come to see you, how can they find you?
Okay, perfect. So I'm Dr. Kumkum Patel, and I'm a board-certified gastroenterologist. I currently work in a private practice in downtown Chicago. And I completed 3 years of training right here in Chicago and downtown at University of Illinois. And during my training, I had the opportunity to go and do specialty training at Washington University in St. Louis through the American Neurogastroenterology and Motility Society to learn about IBS and get trained in specialty upper and lower GI motility. So this has been my focus, and I find it extremely interesting, and it's something that I'm very passionate about. I myself have experienced IBS symptoms and have, found that this is something that patients really need and want to be able to talk to their doctors about. So, and a lot of the patients happen to be women, and they connect better with women doctors. So I figured, why not be that woman doctor that is able to help my patients? So that's what got me to do this.
I love it. I love your personality and your approachability, just your whole energy. It's good. So
thank you. Thank you so much.
Yes. Yes. All right. So let's jump into then IBS. So tell us, what is it?
Okay. So IBS, for those who don't know, is Irritable Bowel Syndrome. It's part of the functional gastrointestinal disorders group, where basically it's characterized by recurrent abdominal pain, altered bowel habits, and symptoms such as bloating, distension. It can be constipation. It can be diarrhea. And basically what it is it's triggered by a change in the gut microbiome, which is the bacteria that's in your body, that's already in your gut itself. And that's altered either through stress, through anxiety, through depression, through antibiotics, through travel, for whatever reason. And that change in the microbiota then leads to these symptoms. And with changes in hormones, with changes in how your mindset is, that it leads to a change in the bowel habits itself. So that is basically IBS.
Yeah. So tell me a little bit about what are some of the things that we can do for IBS. If someone had, do you need to go to a physician to get an official diagnosis?
Well, usually what happens is that, with patients with IBS, they try to kind of look online and kind of, Google their symptoms, which has a lot of effect, because they say, okay, I read online that maybe my bloating, my distension has to do with my mood, or, I've tried XYZ diet and, this worked or this didn't work. And, what should I do? Is this real? I want to make sure that this isn't something dangerous. And so, that's when they come and see a gastroenterologist. Oftentimes they've already gone to their primary care physician, and they usually end up getting a referral to see a subspecialist like myself. And, that's when I see them for the first time. Usually I get a good, thorough history as to what's going on, whether or not they've got underlying anxiety, depression, if they've had family history of any GI diseases, if they have family history of GI cancers, if they've had recent travel, recent antibiotics, any of those kinds of things that can possibly predispose them to irritable bowel syndrome. Getting a thorough history is the most important thing. So that's what I spend a lot of my time on when I see these patients in clinic, is trying to understand what exactly is happening with them. As a gastroenterologist, I want to obviously make sure that before I say that this is irritable bowel syndrome, that I make sure that I rule out, other things, that making sure that they don't have IBD, such as Crohn's disease, such as ulcerative colitis, making sure that they don't have peptic ulcers or a bacteria called H. pylori, and that, there isn't, malignancy or something. Yeah, making sure there isn't something serious going on in their GI tract. And then after that, is ruled out, and then, we do blood tests and things like that to make sure there is no inflammation actually going on, that we say, okay, that this is actually irritable bowel syndrome.
Yeah, good. Okay, so then once you figure it out, then what is the treatment program look like?
So
I know it's going to vary.
Yes. So with IBS, technically, you can do a diagnosis just by history itself, saying, okay, that you have a change in your bowel movements, and you feel better, and the symptoms are resolved after, after defecation or after you have a bowel movement. And if you log and journal these symptoms, you see that they usually improve after bowel movement is done, and the pain usually recurs if the symptoms return, or if you have increase in the stress, the anxiety, the eliciting factors. But usually when you end up going to a gastroenterologist's office, you will get a thorough workup, which definitely includes stool studies to make sure there isn't a virus, a bacteria that has occurred. Make sure that there isn't H. pylori bacteria, which can cause ulcers, can lead to lymphomas, cancers. Usually it'll also include an endoscopy and or a colonoscopy based on whether or not the patient has certain types of symptoms, to make sure this isn't what we call microscopic colitis or inflammatory bowel disease. These are diseases where the actual lining of the colon or the stomach is actually inflamed, and the symptoms that they're having can be exacerbated by irritable bowel syndrome, or be in the setting of having these other diseases. People who have Crohn's disease and ulcerative colitis oftentimes, in addition, have irritable bowel syndrome overlapping, but sometimes they can just have IBS by itself. So it's very important to make sure that something more serious is ruled out before we can say this is just plain old IBS, and we can go from there. So symptoms are important, but making sure that the right diagnosis is achieved is important in figuring out what the treatment is going to be.
Right. Absolutely. Do you see that irritable bowel syndrome may lead to a more serious condition like Crohn's or ulcerative colitis?
So usually irritable bowel syndrome does not lead to having UC or Crohn's. It's usually the other way around. People who have ulcerative colitis or Crohn's may have overlapping IBS symptoms. Usually having those diseases predisposes them to be in a state of high amounts of stress, anxiety, because again, having a disease that is, that grave can be very distressing overall, and can provoke, a lot of stress in your life, anxiety in life. And so that in itself can trigger pain symptoms, distension, increased bowel movements. And so oftentimes it's not the actual disease process by itself that's causing symptoms, but also overlapping IBS.
Very good. And so then what would a treatment program look like possibly if you had everything else ruled out, you have IBS? What are you going to send somebody home with?
Okay, so first of all, hello to everyone new that's joining. I see
I know.
all the people joining. Hello.
Yes.
Thanks everyone who's joining in this afternoon. I hope I guess on Eastern Standard Time, this is lunch hour. So hopefully this is a great lunch hour to everyone. Hello.
I know. I see somebody from India here, and earlier we had Colombia and Poland. So it's amazing.
Nice. I see a Canadian flag. All right. Hello, everyone.
It's amazing the ability of this platform to be able to connect all over the world.
Yes, all over the world. I love it.
Yeah.
I love it. Great. So for those who are just joining in, we're going to talk about the treatments for IBS. So let's say you've got IBS and the symptoms are predominantly, it's predominantly just bloating and distension. Oh, I don't know where your screen is.
I was doing, there's so many little buttons on here and I'm trying to wave and I think I just accidentally flipped the screen. So.
Yeah, no worries. I was like, I think you flipped the screen, but that's okay. All right. So for those who are just joining us, we're talking about the treatments for IBS. And it depends on what really your symptoms are. With IBS, you can have constipation predominant, diarrhea predominant, and some people are mixed. At sometimes you have alternating amounts of diarrhea, other times you have constipation. For some people, you have normal bowel movements and your primary symptoms are actually bloating and distension. So it depends on what exactly the symptoms are as to what the treatment is going to be tailored for. So now let's say we've got someone who's got a lot of diarrhea. With people who have IBS diarrhea, the primary thing is to figure out what is causing the diarrhea, whether it's a period of stress, whether it's, certain aspects of their job that's causing stress, whether it's underlying anxiety, whether it's underlying depression that's causing the diarrhea, or if it's a change in the bowel habits after having gone to another country, enjoyed their, different diets, and exactly. And then you have what we call post-infectious irritable bowel syndrome. Okay. And that can happen with a change in the microbiota overall. But with IBS-D, which is the diarrhea, there's quite a few treatments out there. Well, first you can do fiber treatment, where you're trying to kind of bulk up the stool in itself. And the ADA recommends that women get 25 grams of fiber a day, and men get about 38 grams of fiber a day. So 38, yeah. So that's quite a lot. But you don't really have to worry about it. There's so many apps out there now where you can track. You can just scan the barcode on your food and figure out how many grams of fiber you're getting. So as long as you're getting the recommended amount, there really isn't any issues really on tracking it. Now, if your IBS has to do with underlying anxiety or depression, TCAs, tricyclic antidepressants, are actually recommended for treatment in irritable bowel syndrome. Tricyclic antidepressants are also anticholinergics, which means they slow down secretions overall in the bowels and can slow down how the gut actually moves. And by kind of slowing down the mind and calming it down, it does the same thing with the gut. It kind of slows down the gut, slows down how often it kind of contracts, because your gut is over contracting and allowing for diarrhea to happen because it's not able to absorb everything and the water, so it comes out as diarrhea. So if you kind of slow down the mind, get it to kind of calm down with the TCAs, it also has the effects. There are cholinergic receptors on your gut, and they are able to benefit from the tricyclic antidepressant. Other medications are iloxatilene, or formerly called on TV as Viberzi. And so Viberzi also, helps with slowing down the bowel movements. And this is a mu opioid and kappa opioid receptor agonist and an alpha opioid receptor blocker. And it's FDA approved for IBS-D. And basically the papers are showing that it helps with global symptoms of calming down the bowels, also helping with pain symptoms because it has the ability to target those pain receptors. And by doing so, it's kind of bringing both the pain symptoms and the diarrhea symptoms down. One thing we see is that, a lot of people are taking loperamide for IBS. And the new paper that came out recently in the American Journal of Gastroenterology actually shows that they recommend against using loperamide in just the overall symptoms for IBS. Yes, it slows down the number of bowel movements you're having, but it might not actually relieve the pain, the distension that can be involved with IBS.
Okay.
So try to target those. That's really important in IBS in itself.
Good.
And then the other thing is, there are great probiotics out there. A lot of what happens in IBS in itself is that, there is a change in your microbiome. So if you want to kind of jumpstart and restart how the bacteria in your gut is, feed it good bacteria. Align probiotic is one of the probiotics that's out there. It's got bifidobacterium and lactobacillus and 2 other bacteria. They're great, and they are recommended in patients who want to kind of help refeed their gut with good bacteria to use those kinds of things.
And what was the name of that one again?
Align, ALIGN.
Okay, Align.
And again, this is to kind of help overall with like the bloating, the flatulence. I see some people talking about here how to combat the bloating and the flatulence. Sometimes you might not even have the diarrhea, but you might just have distension. You wake up and you feel like you're you feel like you're 10 months pregnant, and you're like, okay, how did this happen overnight? And then throughout the day it goes down, or as you start going throughout the day it feels better, and then sometimes it gets worse in the evening. So a lot of people really benefit overall from having these probiotics.
That's good.
Yeah, go ahead.
And they can do that over the counter.
Yes, at CVS, Walgreens, Walmart, any of those actually places have these probiotics available. You don't have to get Align. It's maybe a little bit more on the expensive side, but you can get the generic version of Align. Like there's a Walmart version of it, there's a Target version of it. So these medications are definitely working. I see a question down here. What if I'm bloated after taking probiotics? Then, sometimes there are other things that we can do. If you're still feeling bloated after probiotics, then oftentimes you could have what we call small intestinal bacterial overgrowth. And bacterial overgrowth is where excess amounts of certain bacteria are staying static in your gut and not moving out fast enough. And so because of that, they're having a chance to produce gas, which then causes distension. So oftentimes antibiotics, a poorly absorbed one called rifaximin, street name Xifaxan, really helps with bloating symptoms, especially in people who are not constipated, and can really help with getting rid of the excess bacteria, and then helping kind of re-tailor the gut and kind of give it a fresh start. And it's a 550 milligram dose. It's a 2-week course, and you take it 3 times a day. And after that, it should kind of help with a gut reset.
Okay. Candida. There's a question about Candida.
Oh, maybe I missed it.
It's here. Can you see it now?
Tell me.
Is
Can
that
it cause
like
Candida?
Candida?
Rifaximin is not like Candida. No. Rifaximin is a non-absorbable antibiotic. And I think it was derived from rifampin or some other antibiotic. And so it's been derived to target, gut microbes. And it's been known to help, get rid of the excess bacteria that's in your gut and kind of repopulate or allow for the good bacteria to kind of grow and help with the overall global symptoms.
Good. So can you please tell it or write it again, the name of the medication? I can type it in here. How do you spell it?
Rifaximin, Rifaximin.
Okay. There we go.
Perfect.
Excellent.
I think there was some questions also that were asked recently on the
stories. Yes, let's get
to the Instagram stories.
And I know we have we may not be able to cover everything, but we'll do what we can. So FODMAP.
Sure.
Are you what are your thoughts on the FODMAP? Do you advocate for it? You don't need to go into everything about it, but do you think it's a helpful thing?
So with FODMAP diet, the most amount of studies has been done on FODMAP diet. And overall, they say that with FODMAP diet, it can help a low FODMAP. So for those who don't know what FODMAP is, let's just quickly say what it is. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So if you can say that 5 times fast, great. If not, just use the word FODMAP. So these are basically fermentable sugars that are seen in a lot of foods, fruits, vegetables, beans. They have these fermentable sugars within them. They're the healthy carbs, if you will, that exist. But because these carbs and these sugars have to break down, they can cause certain amounts of distension and pull in water. Overall, the evidence that have been done in the randomized controlled trials shows that there's a possible benefit for overall IBS symptoms in roughly half of the people. But again, this isn't a cure-all. It doesn't mean that if you go on a low FODMAP diet that all of your symptoms are going to go away. But what it can probably do is that it can perhaps trigger less symptoms to occur if that's what you're having. So if eating
you
Brussels
can find
sprouts,
your triggers.
Exactly. You can, if eating Brussels sprouts significantly causes distension and pain and diarrhea for some people, then perhaps, avoiding Brussels sprouts is good. But if you followed some of my posts, I talk about brassica, which is something that you can find in Brussels sprouts. It actually kind of helps with gut motility and getting the fiber, because Brussels sprouts are great. Yes, they cause you to feel gassy and things like that, but they have a lot of nutrients and nutrition and a lot of fiber in them, so they do help some people. But if it doesn't help you, then perhaps and eliminating is something that is possible for you, then eliminate it and see if that helps.
Good. I'm going to quickly, just because there were a few questions about the pelvic floor, we've got to bring that up, right?
Yes.
So here's our pelvis, and here's the pubic bone in the front, tailbone in the back, and then you have muscles here that connect all the way back. You have 17 pelvic floor muscles. One of the jobs of the pelvic floor muscles is with bowel control. So we need the muscles to stay closed so things stay inside. And then we also need them to relax so that it passes. Okay.
Correct.
So that's a summary of the pelvic floor and irritable bowel. We may not do we won't do anything with the medication side, but we can help with bowel retraining, pelvic floor retraining if you're having constipation or leakage. Even doing some retraining with that can be very helpful. And also physiological quieting. So with the anxiety component and the stress component, we use biofeedback a lot. And so learning how to calm yourself and to let go, and that can be a very helpful thing. So
I absolutely agree. So go ahead.
Anything to add on that?
Yeah. So I see a lot of patients who come in with constipation symptoms, and oftentimes after childbirth or after, unfortunately, either pelvic surgery or pelvic trauma or even sexual trauma, they have it, and it could be far in the past. People complain that they just haven't been able to poop just quite the same since then. And oftentimes it's not because their bowels are slow, it's because their pelvic floor muscles are no longer coordinating together. What happens is that your internal anal sphincter is supposed to relax, and then when you are ready and near a bathroom, your external pelvic sphincter is going to relax, and then you generate enough pressure, and what happens is that you are able to poop. But now, if that doesn't happen together and they don't coordinate synergistically, what can happen is you get what we call dyssynergic defecation. And dyssynergic defecation can make the person feel like they're pushing poop against a wall and like nothing's coming out, and they're having to lift their legs up or shift from side to side or
strain really hard,
having to even use their fingers to evacuate bowel movements. And this can feel really difficult. And so some people end up trying Miralax, a lot of laxative therapies, but unfortunately that doesn't help. And so what can be done is a diagnosis through something called anorectal manometry, where a small probe is inserted into the rectum, and maneuvers such as the rectal pressures are evaluated when people are pushing, when they're squeezing, and we can actually see whether people are not generating enough pressure to poop, or if they're generating too much pressure and not allowing enough relaxation for the poop to come out. And with that, we can diagnose dysenergic defecation. And I happen to read those. So if you're in the Chicago area and you're looking for someone to perform anorectal manometry, then feel free to make an appointment in our clinic, and I'm happy to address these issues. But
what is the name of your? Sorry, go ahead. No, what is the name of your clinic, or do they find you under your?
Yeah, so you can always just Google me, and it's the Illinois Center for Digestive and Liver Health, and we're in downtown Chicago. So you can just Google me, and you can find our website. It's icdlh.com. Again, that's icdlh.com, and you can find our phone numbers there. And then if you do come and then we diagnose you with pelvic floor dyssynergia, the treatment for it is like you said, is pelvic floor therapy and biofeedback, which are amazing.
Yes. Okay. Two real other quick questions, because I know we're gonna we have a time limit here.
Yes.
Does it eventually resolve, and then also exercise and IBS?
Okay.
And,
so exercise.
Go ahead. No, you.
So exercise and IBS are excellent. Studies have been done where they did a 12-week a trial where they looked at people who did exercise versus no exercise, and doing 12 weeks of exercise in those patients who participated in that trial actually had significant improvement in their constipation symptoms. It didn't show as much how people who had the diarrhea, but moving your body helps move the bowels. So especially if you're constipated, doing that is really going to help overall with the constipation symptoms. And then the other question was,
does it eventually resolve, or are you stuck with it forever?
So with IBS symptoms, it can improve and resolve if the underlying treatment symptoms are addressed. So if anxiety or depression is what is leading to those symptoms, treating it with, let's say, either a tricyclic antidepressant or an SSRI, or combining those with pelvic floor therapy, combining it with probiotics, antibiotics, fiber, exercise, all those things, they can certainly improve and even resolve. But with changes in your gut microbiome or changes with your stress, anxiety, they can return. So it's important to kind of keep up with those therapies and make sure that you're keeping the underlying cause down and kind of mitigating that in order to make sure that the overall IBS symptoms stay away.
So just to address a couple things here, in terms of being able to access this after we're done, it will be on my story. You go to the little avatar, the MyPF avatar, you open it and you click on live, and then it will be available for 24 hours. I'll also answer some of the sticker questions in my story, and I'll tag you, and you'll probably put them in your story too.
Yes.
And then I'm screen recording this, and so I'm still working out the logistics of uploading it to IGTV and YouTube, but it will be available at some point on both of those platforms, and I'll put it in the story and we'll connect. And then Kim was wanting to get the article about exercise and constipation. So we'll connect, and I can post that link to my story, and we'll get it to you guys. So
perfect.
Is there anything else that you'd like to add before we go for today?
No, it's just that, be cognizant if your symptoms are any of the ones mentioned above. You may have irritable bowel syndrome. Talk to your doctor. Don't feel ashamed to talk about these symptoms. Don't be ashamed to admit that there might be something else underlying in your life that may be contributing to this. Be cognizant of the fact that, everyone has to some degree experienced this at some point in their life, or may experience this at some point in their life down the road. And this is nothing to be ashamed of. There are therapies out there, so get help if you need it.
Yes, good, excellent. I really, really appreciate you taking your time, and I look forward to doing another one of these and more. So
yes, I agree. I can't wait.
Yes, thanks again, and thanks everybody for joining us. We really appreciate you, and have a great evening or rest of your day wherever you are.
Yes.